Lily, thanks very much. Dr. Belen Garijo, who's a member of the board and CEO of Merck Healthcare, Rasha Kerech, Vice President, the Merck leadership team who's with us here today, Eva Muchemi, who's my friend and is the CEO of DMI. I haven't seen her, but I believe she must have been around. Professor Otieno Abinya, who's really known as the father of oncology in Kenya, Benda Kithaka, colleagues in the healthcare provision, members of the media, distinguished ladies and gentlemen. It gives me great pleasure to stand here to launch yet another key milestone in two of the non-communicable diseases or degenerative diseases that is becoming a serious threat to Kenya, that's diabetes and cancer. More so, working in partnership with Merck, the world's oldest pharmaceutical company, as Dr. has told us, started in about 1660. There's no doubt that we are getting quality, mature, and professional partnership, given its reputation. And the fact that the CEO herself is the one who's come. I know that talking to the CEO, she tells me Africa accounts for hardly 1% of Merck's turnover. And I believe a lot of the blue chip pharmaceutical companies, their CEO don't know where Africa is. In presentation, they're told, if they're from America, they say, when you get to Paris, you turn right. Today, we demonstrate our commitment towards the fight against diabetes and cancer as we launch the first combined diabetes and cancer awareness prevention campaign here in Nairobi as part of capacity advancement program. Diabetes is a silent and a deadly disease which is growing rapidly in Kenya and across Africa. It is sad to know that people who survive HIV and hepatitis die from diabetes, which can be managed and prevented if found out early. Therefore, such partnership with reputable and innovative companies such as Merck will help decrease the social and economic impact of diabetes, which is regarded as one of the most challenging healthcare problems in the 21st century. The Nairobi County government is mandated with implementing programs for non-communicable disease prevention and control in order to reduce morbidity and mortality attributable through appropriate health interventions. Due to lack of public awareness about prevention and early detection, most reports that are received at the health facilities come when cancer is at an advanced stage, which poses a challenge because nothing much can be done to save a patient's life. It is important to note that once diagnosed, early cancer can be treated and cured. Therefore, the government of the County of Nairobi appreciates private-public partnerships with reputable companies like Merck to promote key health guidelines and raise awareness on detection and prevention of cancer. We must therefore utilize such strategic approach if we need to counter the associated threat of these diseases. I'm aware that each and every single individual has had contact with diabetes or cancer. From the statistics that we were given and Professor Abinya gave, I'm told that cancer is fast overtaking malaria as the cause of death in our country. So I really congratulate Merck for this partnership and the seriousness with which they've taken it. I know that the CEO was once here 15 years ago. When she was working for Sanofi. And then this is her second time and she won't have much time to stay. She arrived last night and she's leaving this evening. But I'm quite encouraged talking to her. She tells me that she is coming back with her whole board in November to visit us as part of this program. So the seriousness with which they take this partnership, which must be lauded, I congratulate Kenyatta National Hospital for spearheading this because it's only 8 weeks ago that we were together when we launched the telemedicine, the University of Nairobi. But I would like to call upon media because prevention requires that there's knowledge, there's education. People who come to hospital come because they're not feeling well. Probably they're not the best target. The best target is people we go and meet in communities. So organizing health education, health awareness campaigns and programs within the communities, together with health professionals, would go a long way in helping the spread on prevention. But also the media, I know that Citizen is here, I know KTN is here, probably Nation is here as well. I would like to appeal to them. I know that if it was a politician, if this was a political event, or if it was a political rally, there would be about 20 cameras. But you have a very, very significant role to play, because if you can partner with Merck, the university, Kenyatta National Hospital, with other health professionals to spread this good news about prevention, about early detection, about early management, it will reduce deaths, it will add a lot of value, probably more value than the reports you do about politicians. So let me conclude again by thanking Merck and congratulating them for this great partnership. Asanteni sana na Mungu awabariki.
Thank you very much, Your Excellency.